My name is Michelle Lifshin, and I'm the Director of Network and Peer Services for Honor Own of Maryland. When I first learned about peer support, I was an undergraduate student studying psychology. I remember feeling disconnected from the heavy focus on diagnosis and medical models, and I didn't know it then, but really what I was really seeking was a greater understanding of my own experiences, and I'd wondered if I chose the right path. Then I found Honor Own of Maryland and the Anti-Stigma Project, and a whole new world opened up for me. I had no idea what mental health advocacy looked like, what the peer movement was, what system reform could even look like. To this day, I'm immensely grateful for Mike Finkel and Jennifer Brown for giving me the opportunity to intern with the organization and for their support of mentorship and guidance, and then for offering me a position. I was so inspired by the hard work, determination, acceptance, and strength I witnessed from the peers around me, a world that felt so different from my undergraduate experience. This inspiration led me to go to receive my master's degree in public health, where I focused my thesis on the impact and value of peer support. Without the support, knowledge, patience, and guidance of the peer leaders around me, I would not be where I am today. Yesterday and today, I feel reinvigorated being surrounded by so many inspiring peer leaders. If you joined us yesterday morning, you may remember Mike Finkel explaining how the support group that launched the peer movement in Maryland in the 1980s took their name from the book called On Our Own by Judy Chamberlain. Judy was a passionate activist for patient-controlled, peer-run alternatives to the traditional mental health system. It's my honor to introduce another passionate and paradigm-shifting advocate to our conference stage today. Vesper Moore is a MAD liberation activist, trainer, writer, and psychiatric survivor. They have brought the perspectives of MAD people, disabled people, and psychiatric survivors to national and international spaces as a consultant to both the United States government and the United Nations on shaping strategies around trauma, intersectionality, and disability rights. As a self-described MAD, queer, Indigenous person, Vesper has made it their life's mission to rewrite the narrative of mental health industrial complex has enforced on our society. Vesper, welcome to the Honor Own of Maryland community. Thank you so much for being here with us today.
It's great to be with you all, and it's a great honor to be here. On Our Own, as a book, that very concept, the fact that we were on our own from an infantilizing, sometimes harmful mental health system to really develop our own patient-centered, patient-controlled, peer-run ideals was so important and pivotal to me. And I think when I think about that concept of on our own, it really brings me to a place in our history where, often it isn't honored the fact that we as people with mental health diagnoses, we as people, as persons with disabilities, we as MAD people, we as however we may identify, have always been on the outskirts of our society in terms of whether or not we're viewed as people who are a danger to themselves or others, whether or not we are validated and present in those spaces. And validation now more than ever is so important. Connection now more than ever is so important, which is why I'm here with you today to talk about peer support and the history of peer support in the mental health system, where we are now, where we are going, and as we look at this journey, what is needed from these many different intersectional movements, from our workforces, from the coalitions we build, to the organizations we build. Because although when we are in these spaces in the mental health system and we feel so alone, it is in collectivities that we find our reservoirs of hope. Right. And I'm talking about hope as a discipline, hope as something that is a challenge to find today, a defiant act it is to hope when life is so hopeless. Emotional distress is at an all-time high. And as you know, as we continue in the COVID-19 pandemic, We are seeing a mass disabling event, a traumatic event for many different people in different ways that can only be understood through an equitable lens. And as we look at this, we see a lot of people coming to a realization of, wow, this is what it feels like. This is what it feels like to struggle. This is what it feels like to be in isolation. This is what it is like. So I want you to think about that idea of hope as a discipline, because for me, although this has been such a harmful and difficult time for many of us, that we are actually challenging our idea of how we can approach mental health in our larger society. We are talking more and more about peer-run supports. We're talking more about peer-run respite. We're talking more about resources like soteria houses, which are integrated and run with peer supporters. And we're talking about this idea, right, that lived and living experience has value to the narrative of what trauma healing is in our society. With that, something that I see in our history when I go back to the 1970s and early on is I see this idea that as we were trying to really get this full etiological, all-encompassing idea, right, of mental health as it applies in its mainly environment, right? It's not a deficit, right? It's this idea that we have these experiences, and just like the very ecosystems of the earth we live on, that distress is caused by so many different things. I myself, being someone, being an Indigenous queer person, and a mixed race Hispanic person, I grew up in project housing in the second largest city in New England, Worcester. And I grew up with a metal door at my home with bullet holes in that metal door. When we talk about environment mattering and this idea of despair and suffering, and how we don't often understand that in oppressed communities, in that environment, in that approach, in the experiences that we have, you cannot simply have a blanket approach. You can't simply say, this is the causality. This one thing that has occurred is the causality, right? We have to challenge that notion. We have to take it a step further. And as peer supporters, we are advocates in these spaces. And I'm telling you today that it's possible, that through our work collectively, we can inspire peer support in more spaces. Somewhere to start. So the idea of consumer survivor ex-patient movement, prior to that, the idea of us recovering, the idea of recovery, the idea that we could do well for ourselves and lead a life just like any other person was out of the question, because we were bogged down in this deficit model that we still see today. As we expanded our idea beyond recovery, we expanded into different areas of, well, wait a second, I don't want this idea of I have to be recovered enough. I don't want this idea of this is what it takes to be what is considered a functioning person in society. Why is it contingent on my productivity, what I produce, that I have value, but it isn't contingent on who I am as a person, what I contribute to our society? You see, disability rights is different when we talk about the mental patient. Think about that. Disability rights is different when we talk about the mental patient, when we talk about the person in emotional distress in the community, when we talk about the unhoused people who seem like they are so visibly struggling that it makes people feel uncomfortable because they look into their eyes and they realize, wow, that could be me. We have to challenge a lot of these ableist ideas. We have to challenge mental health discrimination largely in our society. And the way to do that is we have to challenge those social ideas. So going back to the 1970s, we have that idea that's coming up, right? And along with that, there's a raise of many different perspectives, right? Some people felt like consumers of mental health services, right? They identified as such. There were others who identified as ex-patients, former patients of this larger system that may or may not have been harmed, may or may not experience that intersection of survivorship, right? Or maybe felt like consumers in different contexts. And then you had people who identified as ex-inmates because they didn't feel what they received was at all treatment. And then with that, you had this idea of survivorship. To say that we would survive something that is supposed to so readily help us is a challenging idea, especially something that is so critical to our society in the way of how do we approach and treat mental health? How do we reach that point? And yet, just like with anything else, the system in a lot of ways was built without people in mind, or even with people in mind. And in that way that they had them in mind, it was a way of well, we can have these communities here, we can have these communities here, right? Redlining is a good example of that. When you look at systemic racism and communities being redlined into lower income communities, because of the fact that, well, by having Black, Brown, Indigenous people of color in our neighborhoods, it's going to bring property values down. But that is on a socially constructed idea that Black and Brown people are less than, are perceived as violent, that the inherent idea of racism as it exists in our society. And I ask you to apply some of that, right, to we who experience emotional distress, we who are labeled mentally ill, we the disabled, we who come forward with many different experiences. So what was powerful about that time with people identifying with their experiences differently was that, wow, we can actually take some of this back. We can identify and be outright about our experiences. We can take this a step further. 1970s, mid 1970s, there was a sit-in in Governor Brown's office, governor at the time. And what a lot of folks were looking at was there was a trend of deinstitutionalization. But along with that trend of deinstitutionalization, you had a lot of us going to Department of Corrections prisons. You had a lot of us going into different spaces. And something that was critical about that was that we wanted to transform this idea of treatment to support on our own terms. That evolved into the early concept of consumer self-help, right? Consumer self-help in those spaces. Something that was really unique about this, right, at the time was that, wow, so you had this idea of folks who could never recover. You had this idea of folks who will always be unwell, folks who you will always view as criminal, right? An inherent criminality with their emotional distress. And you'll actually have them leading and driving these services. And, a friend of mine, Celia Brown, often says the story of when she was talking to Judy Chamberlain, and they're at a conference and they're talking about a lot of these concepts. And then Celia asks Judy, who gave us permission to do this? And then Judy replies, no one. We gave ourselves permission to do this. We're doing this, right? And I think there's a subtlety to that. There's a subtlety to that idea of we are incapable, we are not able to do these things, that has been so inherently damaging to us. And the added layer to that is the perception and idea of violence. I mean, so many of these mass shootings that we've heard about recently, and I'd be amiss to not mention them, is that there's an immediate run towards, well, there's clearly an issue of mental illness. These mentally ill people are causing this. They're doing these things. And it is up to us to actually speak to the fact that so often we are harmed and we are in emotional distress because we are harmed, we are oppressed, and we experience these experiences. And that is contextually so difficult in a lot of different contexts. And we can't simply say that it is the mentally ill, it is the people with mental illness who are the cause of this, the causality of this, when in fact it is actually a complexity of experience and what is happening in a person's family and their life. There's intergenerational trauma, there's historical trauma, there's so much in many different contexts. And this brings me to the idea of we must have cross-movement solidarity. Cross-movement solidarity between the peer support movement and disability rights spaces, disability justice spaces, disability justice movements. And the idea that disability, as it applies to a social model, isn't inherently on this idea that there's anything wrong with our body minds as we are, right? But rather, our society needs to be more accessible to us. We need actual violence prevention. And when I mean that in the context of violence prevention, I mean that in the context of we need to address the root causes of mental health discrimination in our society and different forms of discrimination that actually lead people to violence, that actually lead to these things. I think it's so important. Going back a little, back to the point of history, I think it's what was so important then was that there was nonviolent revolution in ways of occupying space, being in spaces, right? Because at that time, we were fighting to actually be self-determined about creating and developing our own services. You know, at that time, it wasn't, peer support wasn't even an option. Right. So it took that advocacy, it took that effort to actually demonstrate that, yes, we can and will do this with or without the mental health system. So something that I find pretty important when I think about this concept of on our own, it is continuing that collective effort together and understanding that we can and do develop for ourselves. We can and do build in our community, both independently and in the support of many different systems. We actually need to be in all those spaces. As you see peer support moving more and more into healthcare spaces, mainstream healthcare spaces, it's so important that we understand that a health justice approach is critical right now. We need to somehow exist in those spaces because our people are in those spaces. Often I see folk being like, well, doing this is a form of co-optation. This is going to co-opt our movement largely. This is going to harm us in these ways. And yes, the co-optation of movements, right? The idea that movements take on the form of a system that may have been inherently harmful to them in some type of way is a reality that has happened. It has happened to many facets of our movement. But while we are here, while we are going into these spaces, how are we in these spaces on our own terms? How are we building our own modalities around peer support to be able to navigate these spaces? There's quite a few ways to do that, right? And the idea is that we're challenging those systems with survivor counter narratives, a narrative that counters the idea that we are unable, that we are deficit, that we are this. You can do this, and you can do this in many different spaces. And as long as you incorporate that idea Are we voluntarily telling the narrative of our people to transform what systems do to better work towards our people, to bring more supports into the community and outside of a lot of these inpatient environments, to build self-determination and peer-run supports in different spaces? That is a defiant act in a hierarchical system. The very fact that peer support exists is rebellious. So again, we should strive to be in all spaces, but we must operate as if it is possible to radically transform systems every day, every single day. And I know many of you may feel beaten down. Many of you may feel as if you've struggled, especially throughout this time now, as there's so much happening in the world, and you are valid in that feeling. And I know it's hard for me to ask you to dare to hope, but I'm asking you to dare to hope and continue. Something that was so instrumental to me early on in my journey was the idea that I have community, I have people who understand what I am going through to some capacity or something like it, right? And the idea that as we seek to transform how our society views mental health and disability rights, that we continue to be in those spaces, and regardless of what happens to us, we persevere. 300,000 disabled people in the United States died as a result of the COVID-19 pandemic out of the million. I want you to really let that resonate. 300,000 people. Masking was disregarded. A lot of spaces disregarded the fact that this continued to impact chronically ill and disabled people. A lot of us were asked to return to work in the same way that we were before, even though we were in deep emotional distress. We have to understand that collectively we are grieving. We have experienced so much. It is different for each of us, but we are truly experiencing that. Something that at that time, going back again, talking about our history, that was a challenge in a lot of spaces was, as we were looking to fund peer support in different spaces, there ended up being more challenges of, well, how are you going to represent yourself in these spaces? Are you going to be able to operate with this level of diplomacy? You can't push back on these ideas so much, right? And we had to think critically about, how are we going to sustain our movement? How are we going to sustain what we do for our people in these spaces? And Judy Chamberlain had written this letter that it would be infeasible for us to not be able to work in these spaces or accept some of this money because we needed to access our people. And as I say this, emergency rooms are full with people in emotional distress. Spaces are full with people in emotional distress. At the height of the pandemic, the Kiva centers, me and quite a few of our colleagues in our community there, we built a peer-run respite called Karaya, and started it at the height of the pandemic as something that was both mobile and both on-site, if you will. We started it out of a hotel. Now, it's an interesting concept, right? Starting a peer-run respite out of a hotel, but at the time, the funding was this temporary source of funding where we would be able to start this initiative up. It wasn't funding for a peer-run respite. It was funding for a clinical respite that we had converted into a peer-run respite. There were a lot of challenges throughout that period of time. But to this day, I can say that 500 people who are in emergency rooms, inpatient environments, fearing for their lives, in a lot of these different spaces, were able to come out or be diverted to kind of get away from those spaces and find healing on their own terms. That's not to say that many environments don't offer value to different people, because our idea of what is supportive to us is inherent to us, even if there is so much that is systemic and inherently damaging about systems. I think something that is so important now as we talk about peer support in different spaces is needing to value the difference between different peer support professions and peer support spaces. As we look at this broader expansion of peer support in the mainstream, I don't know if you had heard that President Biden was talking about, peer support professionals being in different spaces and being Medicaid billable. And it is that Medicaid billing that I am telling you all today is that there's so many challenges posed by that. And there are so many individuals in healthcare systems, in healthcare spaces, that we are not able to reach unless if we move forward on these terms. So it's important for us to organize both inside these spaces and outside of these spaces, right? It's important for us to understand that our role is that of advocacy for people with lived and living experience. There is so much value in what we do because we are reaching deep within ourselves and connecting to others from a place of mutuality through suffering, from a place of finding healing in a world that may have caused you so much harm. To think that so many peer supporters have challenges being understood on integrated teams and in organizations and being in different spaces. This idea that we are in but not of the system. Our values are rooted in social justice movements. Our values are rooted in opposing mental health discrimination. Our values are rooted in disability rights. And remembering that at the end of the day, as we navigate some of these very, very difficult spaces, really, again, rings as that reservoir of hope. That challenge to the idea that we can imagine a world that is different from the one that we live in. The fact that we can imagine this world that is community run, peer run in a lot of ways. And what I mean by that is that, a lot of people talk about different concepts of like, well, if there weren't inpatient units, where would people go? If there weren't some of these spaces, what would we do? And that's why that very idea of on our own building these ideas is so critical. Because yes, the inpatient unit, the psychiatric hospital will be a place of both difficulty in terms of experience, but also a space where people may have felt that like, well, I was really out of control. I was really struggling. That was a space where I went to. And although it wasn't great in a lot of ways, it also helped me in some of these ways. It's difficult to come to terms with the fact that in our society that some psychiatric treatments and medications can be both life-saving and life-destroying simultaneously. We actually have to exist in rooted in these multiple truths to be able to appropriately navigate a lot of these spaces. And as a peer supporter, you're in a difficult space because you're like, whether or not your experience was positive or negative with a lot of these systems, you're supporting people with a variety of experiences. And you're also navigating potentially feeling belittled or not taken seriously on your team that you're working in. You're maybe facing the very idea that some of your family and friends don't understand what you go through or what you do. And I want to let you know that you're valid in that and that you're not alone in that. There's this idea that because of the supports that we bring, the lived experiences that we bring, it is intimidating to a lot of the professionals who may have that experience, who wouldn't dare challenge or speak to a lot of those experiences. And then there's other professionals where it's like my code of ethics legitimately like prohibits me talking about it. And there is a value in how we can invite people to think differently about these experiences and differently about how people navigate these systems and these spaces and about the services that can be offered that may feel intimidating to other spaces. Because again, going back to that idea earlier, that when someone sees a person with a mental health diagnosis who's experiencing emotional distress, they think, I don't want to be like that. I don't want my child to be like that. I don't want anyone in my life to be like that. So then having peer supporters who have these experiences, being in those spaces and being in your face and being like, yes, there was some value here that I have to offer from these difficult and or horrible experiences and or wonderful experiences. The very fact that we could say that some of our experiences with emotional distress can be transformative and wonderful is a challenge too. And then to work through that role in these teams, in these spaces, serves as this point of tension where it's like, well, clinicians can't work with peer supporters. People cannot work in these different spaces, when in fact, yes, we can. The idea is not to challenge the fact that our code of ethics, our experience, how we operate in a lot of different spaces is through that lens of lived experience. It is through being informed from the oppression we experience and having our society take a serious look at it. I think there are so many folks who are struggling with the idea of grieving the life that they've had, grieving the life they have now, grieving what has happened to people, that as they experience emotional distress, as their loved ones experience emotional distress, potentially for the first time, or at least recognizing it for the first time, that there is this instant idea of we have to go back to how things were before all of this happened, before the COVID-19 pandemic happened. And the truth is that we're not going to go back, and we shouldn't. We actually must continue in a new way in understanding that our society has been transformed by emotional distress. Something that I want to share with you all today is that so much of what we do, so much of how we exist in spaces and inspire these spaces may go unseen. But we see each other, we know each other, we are here for each other. And that I often see this trend of the oppressed turning against the oppressed. Many of us in our social justice spaces who instead of having instead of sharing some of these challenging ideas and figuring out how we can work together collectively, we proceed individually. We associate a lot of our movement organizing with individuals, right? And it's important for social justice movements to have leaders. It's important to have that inspiration. But when I'm talking about this idea of in collectivities, we find reservoirs of hope, it is the fact that each and every one of us contributes to what a social movement is, to what a social justice movement is. By inherent definition, it's so important for us to gather, to be in spaces like these, to continue to challenge the ideas that emerge around mental health and disability. So in Colorado, there was the first consumer case management aid. That was what the role was called, consumer case management aid. And it wasn't until later in the state of New York that the term certified peer specialist emerged. And we started seeing that in a lot of different spaces. And there are peer supporters, again, who work in many different contexts. And I'm sure many of you are certified in different forms of peer support. But something that was so difficult about getting there was that the very idea of peer support, the very idea of mutuality and shared experience and connecting in these ways was challenged because so often our response to emotional distress is a pill and isolation immediately before it is connection. So to again have peer support in these spaces is an act of defiance. It is an act of healing. It is an act of fostering that discipline of hope in different spaces. And you know, I didn't want to come here today and really speak to a lot of the pre-established terms that we have, like, for example, you are the living proof, and you know, recovery is real, and a lot of these ideas. But you know, a lot of those ideas came from somewhere that was very true, right? So the intent, for example, with saying we are the living proof is to show that we do exist and we do transform spaces and we do challenge the idea of what emotional distress is in our society. And that is scary. It is scary due to the very nature of folks firstly do not want to experience that emotional the emotional distress in the first place, but also the fact that in the early 70s, when I'm talking about a lot of these things, the war on drugs, that was a very obvious war on race. A lot of those drugs were conflated with social justice organizers, the hippies, Black folks, brown folks. And what that did was that war on race was a tool for social control. By keeping movements separated, by keeping peer support workers siloed, you control the change agents in different system spaces. That's not me saying that every person that works in service systems is conniving and waiting to do something, right? Our government is so large. People work in so many different spaces. For example, the USDA and doing work around food, or you know, to the person who helps you file your taxes over the phone via the IRS. Those folks aren't conniving necessarily; they're working government jobs. But we live in such a politically diverse and complicated spaces, and not everyone there is there for the right reasons. And that hierarchical system by design has not only left people out, but there has been policy to further marginalized folk that we have continued as a society, not necessarily as a movement, but as a society, to build more policies on top of. we are struggling with oppressive roots in our systems, and we have to examine those roots. We have to understand that if we do not challenge these ideas, if we do not challenge how we understand these experiences, that we will only further marginalize all people, but particularly people with mental health diagnoses and disabilities. So how do we do it? How do we radically transform our society and our systems? So public education is the first important step. I think we need more efforts to publicly educate. And I understand it's not our role to publicly educate, but it's so important that people understand that peer support is out there, that peer support is an evidence-based practice, and it has been since 2007 via the Office of Medicaid. And that even if it wasn't an evidence-based practice, peer support exists in every community, in every space. It exists in the Black barbershop. It exists in the Hispanic salon. It exists in the community center, in your family, in every space you are in. Peer support is there. And to attempt to take something like that and bring it into systemic spaces that have been built on these foundations of oppression and to further transform them is such a challenging and hard thing to do, and we have to do it together. So I stand here today saying, on our own, together, collectively, we must continue to build, we must continue to challenge, and to not give up hope, because you cannot radically transform systems without it. And I'm not saying this in a toxic positivity type of way. I'm saying literally, it is difficult to continue to hope and be grounded in the reality of what is happening to us every day. So as we continue to do this, I think what's important is that we continue to challenge policy and create policy too that speaks more to discrimination on the basis of not only a person's mental health diagnosis, but with how they identify with that diagnosis. To build policy around accessible spaces. And I mean that too in workspaces and education spaces. Even though the Americans with Disabilities Act was established over 30 years ago, to see your therapist, to see a peer supporter, to take a moment for yourself is still treated as well, you're just looking for an excuse. You are just like why don't you get over it? Why don't you just get over it? And it is truly in the fact that our experiences aren't often seen, and the fact that people are so ready to avoid them that they don't want to incorporate that policy. This also applies in terms of paid time off. And I'm talking about vacation, I'm talking about bereavement, I'm talking about personal time off. 3 to 5 days is not enough time for any of us. So that's a way to challenge it. Something that I want to speak to that is so important for us is to also closely examine, as the mental health system seeks to make services more accessible to us, that the digitization, how information is shared, how that information impacts us is important, and an important thing to look at. There's an emergence of digital psychiatry. We see a lot of these mental health apps and a lot of these spaces, right? And something that's so important is that when you click that terms of agreement, does your personal information around your emotional distress, around what you're going through in your life, belong to you? We haven't had critical conversations about this. We've started to. I encourage y'all to advocate, even if it's on a more local scale. If people in your area are talking about these mental health apps, talking about these spaces, ask, is my personal information safe? Is the personal information of my friend and my family safe? That's so important. That's so important. A good example of this was the crisis text line that actually shared information around suicide with a private company under the same umbrella. So they were intersharing that information to a for-profit organization under the same umbrella, and it was not regulated. So that, for me, poses new challenges that we haven't even thought of yet. Another thing is digital phenotyping, how we engage with our cell phones. There's a lot of apps that measure, like, are you turning your brightness down because you're depressed? Are you looking up these things because of how you feel? There's so much detail to this that's just so important and is critical to the conversation with peer supporters and people's in these different spaces. So there are so many who have contributed to the foundation of our movement. I'd be amiss to not mention them. Tulia Tesaro and Jennifer Gleisner, who had started the Psychosis Validation Network that eventually led to the creation of Madness Network News, which was this interchange and sharing network that was critical to that time. Jennifer Gleisner jumped off the Golden Gate Bridge and decided to take her own life. And something that was critical to me when I was looking through this history was that she was someone that was not remembered. I think that there's so much value in the remembrance, and as we grieve and have some of these awful experiences, that we continue to uplift each other. So my next point is uplifting each other, making sure that we are seen, that we are understood, that the diversity of our experience matters. And that is whether or not you identify as someone who's mentally ill, or if you identify as a survivor of a system, if you identify as a mad person, if you identify as a person in recovery, that there is value to all of those experiences. There is value to however you may identify, and that there is no wrong way to identify with your experience. It is simply important that there is a transparency and understanding of how service systems harm us, about how we're told that our experience can only exist in a deficit, right? I think another point is that peer supporters should sustainably be in more spaces where crisis response is needed. So something that's been critical for myself has been trying to have peer supporters respond to 911 calls, to other calls, and we see the emergence of 988, and we may be seeing a lot of peer supporters respond to those calls too. And I think it's important for us to advocate in being in those spaces and on our own terms. We need to really, again, use our stories, use our experiences as a tool to politically transform a lot of mental health policy in the United States right now. Something that's going to be so important is as we see these 988 call lines, that we establish things like warm lines in more places, that we establish these true peer-run approaches in these spaces. Because if we don't, private industry is going to come in and take a lot of these ideas. Going back to our roots and our history, once again, something that wasn't as prevalent in the 1970s was private industry. So we're having to challenge something that we don't necessarily fully understand and is not regulated in the same ways. A positive here, however, is that nonprofits and organizations can establish something like a warm line, can build this. So what I'm asking y'all to do is to flip that narrative on its head and actually challenge private corporation by having these approaches such as warm lines in different spaces. I think another thing that's so important to build are more peer-run respites. An expansion of peer-run respites in the United States is so important. I think one of the challenges that we see with peer-run respites is that we live in such a submerged liability culture that we need to kind of allow for dignity of risk and understanding that, wow, well, if we foster people in their own decision making more, if we foster the fact that you haven't had autonomy throughout your life, you've felt like you've lost control in your emotional distress, to instead being like, well, what if your breakdown was a breakthrough? What if there were values in that experience? And even if there wasn't value in that experience and you felt very oppressed, right? How can we work to transform how you view yourself and understand that your value is inherent, that it is not contingent on what someone has told you your experiences are, but rather it is how you have come to understand them. Putting control back into the hands of our people is something that is so important. So as we seek to build these alternatives, I want to also say that hopefully one day these alternatives won't be considered alternatives anymore. There'll be something that's just so prevalent in these many different spaces that they seek to transform our very society. You would think that it wouldn't be so complicated to have resources like these in different spaces, but I think one of the challenges is as long as our society does not want to face emotional distress and mental health very honestly, we're going to continue to have coercive and damaging service systems. I'm telling you that peer supporters, we have the power to actually have our society take a close look at itself, as you've had to take a close look at yourselves throughout your journeys. And with all of this being said, you know, it's so important to understand that through this darkness, we emerge not by avoiding it, right? Not by going around it, but by going through it. That's a quote from Leonard Roy Frank. And what that quote really means to me is the fact that you gain a better understanding through closely examining the darkness of those experiences. And that it is not through encouraging or going back to some type of normal that we will truly transform and work through the grief and emotional distress we are experiencing in our society. It is through taking a moment to examine that darkness and actually sit with it that we will get there. It is through having honest conversations around emotional distress and breaking down the barriers pertaining to those taboos. It is about challenging every service professional to understand that they are unscathed from trauma and emotional distress in our society, that we are experiencing a mass disabling event, that it is statistically very likely in your lifetime you will become a disabled person, a person whose society is inaccessible to you. So why don't we think critically about accessibility every day? It is through cross solidarity in our movements and understanding that we have this power that we can truly transform our society. Thank you.
Thank you so, so much, Vesper. If you're okay with it, maybe we could take some time to answer some questions. Um, but I guess first I want to say that was such an amazing, impactful, and empowering presentation. I saw the chat going off with folks saying, I love what you shared. When you said one's breakdown could actually be a breakthrough, folks saying I teared up when they said dare to hope, folks commenting on your passion that's just evident. So really big thank you. Your presentation was really inspiring. I heard you touch on the importance of hope and being an active act and a discipline, the importance of intersectionality and the power and need for collective advocacy. So one of the questions that we had is, what do you think the future of peer support looks like? And I guess to expand on that, what are a few areas that you would like to see the peer support movement focus on, improve, or expand? Like, where is there a need?
So I'm going to get to the most difficult conversation, documentation. So we need to establish on our own terms how we represent our survivor counter narratives in different spaces. And we need to establish that if a lot of these grants and contracts that emerge around peer support are going to require documentation, that we have our own form and approach to telling the stories of our people. Because by avoiding telling the stories of our people, clinical documentation is then enforced upon us, is then enforced upon these spaces. Another challenging piece of that is that we then don't demonstrate how peer support works. We don't demonstrate how we can sustain a lot of our efforts. And that's not saying, well, you should just give up and write that this person has schizophrenia or that this is their experience, right? But rather you should ask them, what's the story you want to tell the professionals that don't think that you have any value in our society? What is that story? How much of that do you want to convey? And by doing this, peer support can continue to exist in healthcare spaces, and we could take a health justice approach, because if there is a system that is most damaging in this country, it is the healthcare system. And we need to be in those spaces because there are people who are engaging with their primary care, and we're not there, and we never will be there if we don't figure out how we can exist on our own terms.
That was a beautiful answer. And I think just hearing how you're talking about working with people to be able to come up with things that can be documented, that feel comfortable, that feel empowering, that don't feel super medical model. And it kind of reminds me of the presentation earlier from Todd, who was speaking about how they're documenting the impact of their peer respite and really asking questions about, did you feel like connected to the community? Did you feel isolated? Did you feel, and some other questions that I can't recall at this moment, but really kind of tailoring to satisfaction and to yeah, I lost my train of thought. But another question that we had is, if I'm just starting out in the peer community, what is something small I can do to start building collectivity?
So I think ways in which we build collectivity really come from first fostering that space in some type of way. And I think in order to foster that space, you actually have to challenge how we understand connection, how we understand empathy, how we understand each other. And what I mean by that is that there's so often this narrative of, well, you can only speak so much to your experience and share so much about your experience. And genuine human experience, the honesty and the transparency in which we navigate these spaces is often frowned upon. It's often frowned upon to be honest about what you are going through. How often do you ask, how are you? And then someone says, fine. And then they keep going. Even if there's a war in Ukraine, even if there is a pandemic that they're fearful of, even if a family member is dying, you're expected to bury it and move on. And I think in order to truly foster community, we need to move forward in a way that's like, yes, I can indeed talk about what I'm going through. If you're going to ask, how are you? Do you actually want to hear it? Um, we should be fostering a lot of those ideas in different spaces. And I know that sounds like a small thing, but it's not. It's it's truly in a lot of ways how that subtlety of mental health discrimination exists in our society, is that you can't be in distress, you can't be honest about that, you're making a liability of yourself, a situation of yourself. That within itself is not a society we should live in. So in order to foster connection, I'd say invite that through genuine human relationship, but then also at the same time, how do we continue to support community in finding that mutuality with each other? And what I mean by that is that how do we, when we have such internalized ableism and saneism, that we really speak to, okay, well, I don't want to talk about this because my mom or my father or people in my life have told me it's not okay, that I can't share the experience of the voice I hear or the things that I see or the things that I go through. I can't talk about how my emotional state of being is because I have to maintain this idea of straight and narrow, that I am continuing and persevering and contributing to capital in our society, contributing to those ideas. So it's about deconstructing that too, really, to foster some of these ideas. And maybe you've deconstructed it and you haven't been able to find anyone, or maybe you don't agree with what I'm saying at all, and you feel the mental health system is beneficial and that we shouldn't be so honest about our experiences or any of these things that we go through. um, in that, I still say I hope that you foster community in honesty with yourself and the people you care about.
What a beautiful answer. About and it kind of relates to this next question that we have, which is on a local level, how do you begin to kind of mobilize? This is a big question. But how do you begin to kind of mobilize peers surrounding either a specific issue or just in general? And how do you create a space that is motivating, encouraging, empowering? So whatever pieces of that feel right to answer, it's a very big question, but
No, it's fine. It's fine. I would say your district attorney locally holds a lot of power. Talk to your district attorney about decriminalizing mental health, um, and having honest conversations about how we can operate in different spaces. Because the district attorney can often make decisions without even bringing it to the court. You see a lot of these initiatives too around building different types of court systems and spaces, all of these things. And I think something that's so critical is that if we are building court spaces that are supposed to be more accessible to people in emotional distress, that it's taking a restorative justice approach. And what I mean by a restorative justice approach is I mean being able to sit in that conflict and closely work through the situation and taking in full context, right? So what I mean by full context is that, well, this person stole my wallet, and it's like, well, maybe that person stole your wallet because of because they had a lot of this going on, that if they didn't pay this person, they owed a lot of money in their life, that something was going to happen to them, right? And then that person might have been like, well, that money in my wallet, I needed to pay for my medication, and that's why I'm pressing charges. And often we can talk through a lot of these situations and gain that full context. So that's a whole, what I'm talking about is building a whole different court system. Um, and a lot of people wonder, well, when you're talking about building systems, why are you talking about building systems when we should be abolishing systems, when we should be moving towards these directions? And what I say to that is that when you do abolish a system, inevitably you will build a new system, regardless of what you do. So that can be on a completely different foundation. That can be on a completely different idea. I think a lot of our approaches right now are harm reduction, are things that are required in this moment for us to continue to build. When I'm talking about peer supporters in police responses, right, I'm talking about avoiding many different forms of policing from other mental health providers, right? Policing from social workers, policing from different people, having those who are most impacted by these experiences in these spaces on our terms, and us organizing as a movement to manage that sustainably is so important to building these new things. So I definitely say taking a restorative justice approach is a big part. Locally, speaking to your district attorney, many mayors, many local governments make decisions in council spaces that a lot of people don't want to attend. I would say be in those spaces, particularly when they're talking about the person in emotional distress living without a house on the street, right? So that's something that I've definitely done a lot of work for, and locally for our Kiva Center in Worcester, Massachusetts, is that we would host the neighborhood association meeting in our peer-run space. And prior to that, they didn't even want us in the neighborhood. They were like, we don't want those people here. It actually took a lot of conversations to get there. And by inviting them into the space when they had lost their space, which I believe was in a church down the street, they first came in and they were actually like, oh, is this a psych ward? And, even though that's such an offensive statement, I had to take approaching that conversation with such compassion and thought of like, wow, you really don't understand this. Wow, mental health discrimination is of such prevalence in our society that you don't understand this. And collectively, as we make those efforts on local levels, because local government is basically its own confined government in a lot of ways, we will be able to transform the representatives that are in those spaces. We will be having intentional conversations around mental health and emotional distress in those spaces, so those representatives will serve as advocates for us as well. So I think that's an important piece to what we can do on local levels.
What a great suggestion about inviting them into the peer space to hold the meeting. And I think we have time for one more question, and that is, how in your own personal experience, or even in supporting other peers, have you kind of grown to really find your strength in your personal experiences as a peer? And if that makes sense, kind of shifting from this idea that your experiences are make you less than and instead make you powerful and bring something, and how do you help other peers realize that?
So I think a key realization for me was that so much of my emotional distress was environmental. It was a part of my experiences. And then when I looked at those experiences, I saw the inaccessibility, the inequity, the injustice that occurred. And for a long time, as with any person and their suffering, I sat there and I thought, like, wow, I'm completely worthless. I am a burden on everyone in my life. And I internalized those ideas. The point of transformation was when I really saw others in my community who experienced similar things to come together and actually say, well, we're going to do this on our own terms. We don't need anyone's permission, like we were talking about earlier. And I have a great understanding of this because I went through it. I've went through something similar. And even though it's different in every place and every corner of the world that we're in, that our experiences inform our society, and that in order to transform and dismantle institutions, you need social change. You need it must first happen with our social ideas, to then transform the institution, to then transform our relationships with each other, and transform how we look at ourselves. And how we look at ourselves then leads back up into that circle, right, where we're talking about how we transform our society. That leads to that process once again. So I think what it came to was really examining where I was internalizing my oppression around my mental health diagnosis. It took talking about that openly. It took disagreeing with people and existing in discourse, because we have to exist in discourse. That's just the truth of the matter. But we can exist in discourse and understand that we are not alone in our experiences, and that, again, we are transformational. We exist in defiance of everything in our society that says we should instead be isolated and put away. The fact that we do well and we persevere is something that is so beautiful and so profound.
What a beautiful, beautiful point to round us out on. So thank you so much, Vesper, for being here with us today. This was an amazing presentation, and folks were very grateful in the chat saying thank you and how inspiring you were. So really appreciate you being here with us today.
Thank you. I appreciate it so much. It's great to be here with y'all again. That idea of on our own was pivotal to my journey. So it was so great to share my experience with you all. And again, we are in community. We are here together. We are in solidarity, and there's beauty in that. Thank you.
Our mission is transformation. Through mental health or substance use challenges, we found our voice. With 30 years of experience in peer-run alternatives, person-centered training, and systems-level advocacy, we empower agents of change, lifting up leaders with lived experience to shape the future of healthcare. We are On Our Own of Maryland.